Good day everyone. I'll do a sharing on proper handling of TDM for paracetamol and salicylate poisoning cases after office hours in Hospital Bukit Mertajam. This is what I will go through throughout my presentation. This presentation is prepared in a way to help you to understand the workflow. How do we handle TDM for poisoning cases of paracetamol and salicylate received after office hours? Also the management of it. For paracetamol and salicylate poisoning case, TDM can be processed throughout the whole day, which is both office hours and after office hours. TDM analysis carried out in Magma Biokimia Hospital Seberang Jaya. Correct sampling tube is plain tube. As a general rule, one tube of 3 to 5 ml blood sample is needed for analysis of 1 to 3 drugs, meaning to say, for both paracetamol and salicylate, we only required one tube of 3 to 5 ml per sample. Let's move on to general workflow of TDM for paracetamol and salicylate poisoning case. Firstly, doctor call to pharmacy to inform when there is possible poisoning case. Pharmacists need to ask doctor necessary questions. Patient details, name, ward and body weight, dose taken by patient, how many tablets, how many mg, and when was the last dose taken. Then verify and make sure the sampling time is correct. After that, inform doctor, transport and dispatcher PB care need to be arranged by respective ward or unit, and the TDM form and blood samples have to be sent to pharmacy Bekalan ward. This flowchart on process of work is available on TDM notice board in pharmacy Bekalan ward. It's important to follow strictly every single step in this flowchart. Pharmacists on duty will be responsible for the screening and interpretation of result. When PPK send over the sample and form, please ask PPK to wait first while screening. Make sure all the information on form and blood sample is complete and correct. Make sure doctor's sign chop are complete on 3 copies of forms. Make sure the tube and the sampling time is correct, only then we register. Then pass back white copy form plus blood sample to PPK. PPK will then bring the sample to our hospital's lab to centrifuge, then take transport to Hospital Seberang Jaya. Pharmacists then trace result via iLab or call, then do the interpretation and inform the doctor. The target of informing is within 2 hours from obtaining result for toxicity case. Then jot down the time of informing, keep the blue copy and dispatch the pink copy of TDM form. This is the new versions of TDM request form. Registration number we write on top of the form. At the bottom of the form, there is a part of data to be filled in, which is the date received, time received the sample, test time we will write afterwards when we receive the result, initial by the pharmacist who received and screened the sample. This is the old versions of TDM request form. We will write the registration number on top of the form. This algorithm shows how do we manage acute single injection of paracetamol. Firstly, we need to identify the dose ingested. Is it toxic dose or unknown dose? If no, no TDM is required. If yes, let's look at the time of injection. If it is less than 4 hours post-injection, take TDM sample at 4 hours post-injection. If it is in between 4 to 8 hours, take immediate paracetamol concentration. If it is more than 8 hours, commence NSC, immediate paracetamol concentration, ALT. The TDM result then plot on Rumour Material Nomogram. We might have one of these 3 conditions. First, if paracetamol concentration is above treatment line, continue NSC. Second, if paracetamol concentration is below treatment line and ALT is normal, stop NSC. Third, if paracetamol concentration is below treatment line but ALT is above normal range, continue NSC and measure ALT at the end of NSC infusion. If ALT is normal, no further investigation required, but if ALT is above normal range, continue NSC and monitor. Please take note this is the treatment line on Rumour Material Nomogram. Any patient with serum paracetamol level above treatment line should be treated with NSC. We have talked about acute single injection type of toxicity. Another type of paracetamol toxicity is repeated supratherapeutic injection or chronic injection. Sampling time is sampled immediately on admission. Toxic dose is more or equal to 200 mg per kg or more equal to 10 gram, whichever is less, over 24 hours, or more equal to 150 mg per kg per day or more equal to 6 gram per day, whichever is less, over 48 hours, or more equal to a daily therapeutic dose per day for more than 48 hours in patients who also have abdominal pain or nausea or vomiting. The toxic range is toxic if more than 20 mcg per ml. This is the NSC regimen that we currently practice, 3-stage infusions of NSC. We have 3 categories based on the patient's body weight. For these 3 categories, only difference is the quantity of diluent used. Let's move on to management of salicylate toxicity. Sampling time of salicylate is at least 4 hours after injections and repeat the salicylate concentration every 3 hours until the concentration falls. For the toxic range of salicylate for adults, toxic if more than 300 mcg per ml. For children, toxic if more than 200 mcg per ml. For indications of rheumatic fever, toxic if more than 400 mcg per ml. This algorithm is very useful for us to refer for the management of salicylate toxicity. In this algorithm, it also shows us with that salicylate level, what are the clinical features and what are the recommended treatment. These are all the references I used. That's all from me. Thank you for your attention.